I wanted to share what we learned this week in Brainlock in the support group. And there's a really good bunch of tips in step one, and I'll just read a few of them quickly. And one of them is to keep a journal of your progress. So this is really important and something that's hard to do, but I actually had a big piece of progress this week. I played my first soccer game against Europeans, and I actually did really well, but I was terrified before it. I had a ton of anxiety, and I almost thought not to do it. My legs started cramping up, but I played, and I played well enough that they want me back. I had 2 assists, one was incredible. And so anyway, in Brainlock, he says keep a journal of your progress. And so I definitely wrote that out. And he says, because we tend to forget our progress. And so if you chart it, you keep a record of it, it'll help your self-esteem, because earlier in the chapter, he talks about the worst thing that can happen is you get demoralized. Like the worst thing that can happen is you just give up and you give in. And in a second, I'm going to read what he says happens if you give in. So it says, it's good to have some alternative behaviors up your sleeve. And frequently, patients find that one symptom disappears only to be replaced by another. And this is a cause for despair I hear about. Obviously, I have this. I actually we talked about this. You don't really get warned. You just end up with exposures, and you have to respond or not. But the good thing is if you do treat something and something new comes up, new symptoms are easier to control than something that's been entrenched. And so that's good to know. I read that and I really felt better, because it means if you do the hard work and you treat something that's been bothering you for a long time, when something new comes up, you know that it's easier to resist than something you might have been doing for years. I've been checking. I tend to let myself go with checking, and the more I treat checking, the more I know, the more just false messages pop up in my mind, and I know I can just let them go. Welcome if you're joining. Feel free to send a comment if you want, and I'll respond. And this is the clincher here. He says, without treatment, OCD will just beat you into submission. So as far as I'm concerned, if you don't want to be beaten into submission, according to the book, you better do treatment. And he talks about how brilliance has nothing to do with it. He slams Howard Hughes pretty hard in the book. But he also talks about guilt and shame and how we can end up lying and denying just because we don't want to admit it. I had an exposure come up where I was in the washroom and someone was getting changed, and we just started handing me things to dry my hands with, so I had a whole contamination issue. But so in Brainlock, he says, look, if you do the compulsion, you're just assuring that another compulsion will come up. And if you stop it, it feels worse now, and you need to be brave to confront it and work past it. So this is what I like. He says, a coward dies 1,000 times. So the valiant fight off OCD right now. I think it's a really big call to action. The people who've been reading this with me in support group agree. It's a pretty big kick in the pants. And he says over and over, OCD is related to a chemical imbalance. Critical parts of the brain just use too much energy. And it's super painful that even if intrusive thoughts are totally bizarre, or obsessions or compulsions are totally bizarre, it's like the hand washing thing that you think maybe airplanes will crash if you don't. He's just regardless of what it is, the emotional pain is that hard. So and then here's something, apparently compulsive hair pulling might be related to OCD, which I could vouch for. And I'll end on this. One of the examples in the book says, it's Karen, she says what she thought was she could fix the problem herself, and she had false pride. She just didn't want anyone to see her shame. But if she got healthy, she'd be able to have friends, get to actually have a life. She was a hoarder who hoarded her, kept so many things in her house. She just couldn't have people over. She was so ashamed. And one of the techniques she used was she was just so angry at all the junk she put in her house, and it ruined her life. I think that happened for 10 years. Uh, and they don't really know if it's a biological explanation why one person washes or another hoards. Genetics seem to play a role, but he doesn't explain exactly what it is. He says OCD tends to run in families. Parents, people with OCD are usually rigid and inflexible, and they get like uncomfortable if things don't go their way. So anyway, those are some of my thoughts on brain lock for this week's um, reading for support group. I thought I'd share. A lot of this information would have helped me, when I was starting out, and it helps me now. So anyway, if you're going through the struggle, good luck, and I'll talk to you soon.